Examine the patient's oral tissue to ensure they're healthy and free from irritation or sores. This is especially important if the patient has been wearing temporary or ill-fitting dentures. The tissue must be fully healed before proceeding. If any surgery is required, such as reducing a severe undercut of the bone or maxillary tuberosity reduction, refer the patient for surgery correction before starting the denture process. If you're making single arch complete denture, evaluate opposing arch. If significant treatment is required on the opposing arch, complete it before the record collection appointment. If the occlusal plan of the opposing arch is uneven, minor occlusal adjustment or enamelplasty may be performed to help level it. In cases where major occlusal reduction is necessary and there is a risk of pulpal involvement, consider prophylactic root canal treatment and crown placement on the affected tooth. Make sure all such adjustments are completed before proceeding with record collection. Assess the patient's saliva flow for the fitting of the denture. The saliva can affect the denture fit and comfort. Dry mouth can cause retention issue. It is crucial to manage the patient's expectation. The consent form addresses potential issues with dentures. Go over it with the patient. Make sure they are aware of the possible need for denture adhesive and future implants, especially for mandibular arches. If the patient can afford implant, you can discuss the implant at a later time. For patients who have never worn denture before, I always explain that they may dislike them initially. Some people get used to dentures over time, while others may never adjust and may choose not to wear them. In some cases, implants could be the only solution to restore function. Set low expectations upfront so that if issue arrives later, the patient won't be upset, as you've already explained potential problems. They may even begin saving money for future implants. I have provided a sample consent form in the Word document that you can modify for use. I've also provided a setup list and sample setup sheets completed with pictures of items needed for this procedure for your convenience.